You couldn't design a better stress test for the healthcare system than the COVID-19 pandemic. And on some fundamental levels, the system failed. Witness, for example, the racial and ethnic disparities in outcomes that the virus laid bare. Most fundamentally, the disease and the resulting shutdowns caused millions of Californians to lose their jobs, and in many cases, their employer-sponsored health insurance. And there couldn't have been a worse time to lose one's coverage than in the midst of a deadly pandemic. Solving the insurance problem won't fix everything that's wrong with the healthcare system, but it's a prerequisite to almost every other needed improvement. That's because for all but the wealthiest Americans, insurance is key to care in this country. It's simply too expensive otherwise. Unfortunately, insurance itself is rapidly becoming unaffordable too. The solution seems clear to many progressives. Replace the hodgepodge of public and private insurance coverage with one government-provided plan that covers everyone, financed by taxpayers. This single-payer approach would guarantee that everyone could afford the care they needed. It also would slash the billing, collection and paperwork costs that are an albatross in the current system, while giving the government the power to cap overall healthcare spending as it strives to match resources to needs. And it would prevent private insurers from acting as gatekeepers to care and siphoning profits out of the system. Converting to a single-payer system would cause enormous upheaval, however, and the legislature has balked at bills to mandate it. Instead, in 2019 it created the Healthy California for All Commission to study its feasibility. That work is starting to bear fruit. A recent analysis for the commission by Rick Cronick of UC San Diego concluded, as many other researchers have found, that a single-payer system would cost less overall than the current system. That's not to say that the transition would be painless. Having the government pick up the tab for all the costs now borne by individuals and employers would require an enormous increase in taxes, even as premiums and out-of-pocket costs would evaporate. The same report by Cronick, however, identified an insurmountable hurdle. A single-payer system in California would almost certainly require an act of Congress to let the state funnel Medicare and Medicaid dollars, veterans' health benefits and other federal and corporate health insurance contributions into a new, unified insurance system. And single-payer advocates don't have enough votes among Democrats to overcome unified Republican opposition.